Hello and welcome. My name is Christopher Wienett, and I'm the lead communications analyst in Health Workforce Development. Here at HCAI, we're thrilled to have you join us today for the Song Brown Registered Nurse and Licensed Midwifery Technical Assistance webinar. Who this webinar is for, this is for new and continuing applicants to the Song Brown Registered Nurse, RN, and Licensed Midwifery programs. The RN and LM programs provide grant opportunities that will result in funding organizations to educate and train students to work in underserved communities. And of course, Song Brown is administered at the state level by HCAI. Let's look really quickly at the agenda today. We've got the housekeeping and introduction, which we're doing right now, followed by the RN and LM program updates, the application process, and we'll talk about the requirements with our program officer. And then we'll have a Q&A session at the end, and that will be today's agenda. A little housekeeping before we get started. This webinar is hosted on Microsoft Teams. If you're not familiar with the platform, you can find the chat, the view controls in the menu bar at the top of your screen. The chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And this webinar will be recorded and available within 7 to 10 business days on our website. And with that, it's my pleasure to introduce Castanina Naval, the Song Brown Program Officer, who will get us started.
Thank you, Chris. Good morning, everyone. Thank you for joining us today for the RN and LM webinar. Like Chris said, I'm Cassidy Naval, the Program Officer for all RN and LM grants. Before we jump into the application, we're going to do a brief walkthrough of the brief overview of the Song Brown program. So Song Brown funds education programs, including family nurse practitioner, physician assistant, registered nurses, primary care residency, licensed midwifery, and certified nurse midwifery. The Song Brown statutory priorities are graduating individuals who are practicing in medically underserved areas, enrolling members of underrepresented groups in medicine to the program, locating the program's main training site in medically underserved areas, and operating a main training site at which most of the patients are Medi-Cal recipients. So here are some key dates for the RN and LM cycle. The registration is open all the time. So if you are a new applicant, please register now on the website. The application released September 10th, 2025 at 3 p.m. For early submission review, that closes October 9th, 2025 at 3 p.m. And the final submission deadline for the application is October 23rd, 2025 at 3 p.m. Before you apply, here are some things that you need to prepare. Ensure that your program has the proper approvals from your coordinating authority at your institution. Please inform your coordinating authority that all terms and conditions containing the grant agreement must be agreed upon before accepting the grant. HCAI does not make any changes to terms and conditions specified in the agreement, and funds shall not supplant existing federal, state, or local funds. Some changes for the RN existing and expansion programs this year. We did change the number of slots that you will be allowed be allowed to request. For RN, we are moving from 30 to 10 slots at $30,000 per student for the life of the agreement. For expansion, we're moving from 10 to 5 slots maximum at $60,000 per student for the life of the agreement. Just a note, the capitation rate for existing expansion did not change. We are just now showing it to you for the entire life of the agreement for the 2 years rather than yearly. So there will be no import feature for this application cycle. So you will not be able to import your previous information from previous applications. And lastly, for RN existing and expansion, underrepresented medicine students and URM graduates will no longer be scored, and you will only provide that data for collection purposes. Some information to gather for your applications. Make sure that you have your authorized grant agreement signatory and pay data record signatories. We also highly recommend you having your W-9 IRS forms in your at your side when you're doing your application, because we do ask for your organization name, your doing business name, and your address for your program. We also will need your training sites and addresses for all sites used in the academic year 24 and 25. We need student information for those graduating in academic year 24-25 and 25-26, including their race and ethnicity data. For graduate information, we're asking for your graduates from academic years 22-23 and 23-24, including practice site information, race, ethnicity, and their NPI identification numbers for the entry-level master's programs. I will speak on the required documents in the next few slides, so we're going to skip over that for now. So for our new programs, you will need the same authorized signatories as well as your organization and doing business as names. But for the new programs, we need anticipated training sites. So this is going to be the sites that you think you're going to have for your new program, as well as your program expenditures, any costs that will be associated with your accreditation or approval. So the required documents for our RN existing will be the most recent approval letter from the Board of Registered Nursing. For those who are applying for expansion, you will need the approval letter from the Board of Registered Nursing with the number of approved expansion slots or additional slots. For RN and LM, we need a approval timeline for accreditation or approval. This is the schedule that you are going to follow to secure your accreditation or approval. We also need a sustainability letter for your organization. This is going to be a letter from your institution that endorses your program and speaks to the sustainability of your program beyond Song Brown grant funds. Some helpful resources, we have it posted in the chat right now, the link to the HCAI funding portal, the RN grant guide and TA guide, as well as the LM grant guide and TA guide, and the Song Brown glossary. Now we're going to do a walkthrough of the e-app. I will interchangeably say e-app and funding portal. They're one and the same, just to preface. This is going to be most useful for any new applicants or a refresher for our previous applicants. For best experience, we recommend using Google Chrome or Microsoft Edge. To create an account or to log in, you're going to go to the HCAI funding portal website and click on sign in or register. Like I said previously, if you're a new applicant, please register now and do not wait because there are some approvals that we, the Song Brown team, need to do before you can apply. Once you click on sign in or register, you will see this login page. If you're a returning applicant, just sign in as normal. If you are a returning applicant, but you have not signed on since April of 2024, you will need to create a new login because we did transition to a two-step authentication portal last April. So if you have not done that, make sure that you are re-registering so that you have the most accurate funding portal. For any of our new applicants, you will select that sign up now button, and that will take you to the sign up form where you will put your information and get a verification code via email. To set up your profile for any new applicants, you will select the organization user type. Do not select healthcare professional because Song Brown is an organizational grant. So make sure to check off organization. To look for a new organization, I recommend going through the magnifying glass first. Most organizations are already in our system, so you want to make sure to check that before requesting a new one because that takes a little more time and we need to approve it before you can continue your application. If you do need to set up a new organization, you're going to enter your organization name and address in the new organization form. It takes us about 5 business days to ensure that the organization is approved and ready for your application. You will then complete your profile, provide your information, your contact info, and then press submit to make sure that your profile is registered. All newly created accounts are assigned grant preparer roles, so only program directors will be allowed to initiate and submit applications. So if you are the current or new program director for your program, please make sure to email us at songbrown@hcai.ca.gov to make sure that we change and upgrade your profile to a program director role. Program directors can also assign grant preparers to their profile who can assist you in completing your application. All grant preparers should have their own separate profiles in the funding portal. And from there, program directors can assign other users and add those folks to their profile to complete their applications. Grant preparers cannot submit the application. The program director must submit it through their page. Once all of your profiles are set up, you will go to the Apply Here tab on the blue ribbon and select the corresponding application that you are going to apply for. So they are listed as Song Brown Registered Nurse 2025 or Song Brown Licensed Midwifery 2025. Here are some helpful tips to help you navigate through the application. Throughout the application, on the bottom left of every page, you will see a previous and or save and next button. The previous page will help you navigate backwards in the app, and the save and next button will make sure that you are saving a completed page and all the information that you inputted there and moving you forward into the app. If you save and next your page and you want to complete your application at a later time, you will navigate over to the Grant Applications tab in the blue ribbon and find your corresponding application. And all of your saved applications will be there. As you go throughout the application, you will see red asterisks next to some fields. This red asterisk indicates that it is a required field and you must complete that field prior to moving forward in the application. You will also see some blue circles with white question marks throughout the app. This is a tooltip to help you to have additional information on what we're looking for in that field. Now we're going to do a page-by-page walkthrough of the RN existing and expansion application. This is exactly what you're going to experience when you're going through the actual application. So this is a good time for you to familiarize yourself with the structure of the app. The first page you're going to see is the program information page. The top portion of the program information page is pre-populated from the program director's profile page. So if any information there is incorrect, the program director will have to exit the app and then fix what information they need to update and then go back into the app. From there, you're going to select which RN program pathway you are applying for. We have ADN, BSN, and ELM. If you have multiple program pathways at your institution, you can apply for more than one pathway. You just have to have them at separate applications. So they must have separate apps, but you can apply for both. From there, if you are a returning applicant, you will say yes to the Are You a Song Brown, previous Song Brown applicant. Just like organization, you want to make sure to look for your training program title before selecting training program not listed. So use that magnifying glass again, type in your training program name, make sure and check if it's there. If it is, click on it and add that to your application. If not, then you can select training program not listed and add your training program title. For existing and expansion, you will check the corresponding path that you want to apply for. You can apply for existing or expansion and existing and expansion. So for existing, you would check off existing and check off all the boxes listed below to be eligible. For expansion, same thing. If you want to do both, you just check both and check off all those boxes to be eligible. The contract administration page is the page where we would want you to have your W-9 IRS forms to complete it. Talk to your financial or contracting departments at your institutions to make sure that all the information on this page is correct. So the contract org name should come from that W-9 form, and you should only be putting a doing business as name if you have one on your W-9. You will then select your entity type, governmental or non-governmental, and the contract administrator is the primary point of contact for your grant. They are not the authorized signatories. So whoever is the primary point of contact for your grant is who you should put for the contract administration. For the grant agreement signatory, this is your authorized signatory for any grants that your program enters. So they must be authorized to enter into contracts or grants. And please make sure that their email and name is spelled correctly, because if you were awarded, that is how we will send them documents for signature. If you have a different signatory for your payee data or STD 204 forms, you will select no, and you will enter the information for your signatory for your STD 204. From here, you will also enter the legal address that is on your W-9 for your program. And if there is an alternate address that you need to enter for where payments should be sent, you will also enter that on this page. The program description page is the opportunity for you to enter information about your program, what you want us to see, the successes you've had as previous applicants, or the things you want to do with the grant as new applicants. We also want to see how you plan to use the grants, to enhance the education and training of your students. You do have a 2,500 character limit, not word limit, character limit. So if you are copying and pasting from a different document, make sure that none of your description was cut off, because it will just cut it off and not tell you. So make sure you double check your description. For the program data page, if you have any graduates in the 22-23 and 23-24 academic years, you will select student and graduate data. You will only select student data if you do not have any graduates for either of those two graduating years. And then the next question there is when you enrolled your first student, the year that you enrolled your first set of students. On the training sites review page, you will tell us the percentage of total clinical hours that all of your cohorts spent in RNSAs. From there, you will add your training sites using the Add a Site button. And you also have the option to review, edit, or delete any training sites that you entered using the dropdown. This is the pop-up form that will show up once you press Add a Site or Add Site. You will enter your training program name, if they have a private practice, if it is a private practitioner's office, and the address for your training site. We are also asking for the NPI number for your training sites, and we have a link to the NPI registry for you right in the app. For the program expenditures page, you will this is where you're going to be requesting the number of slots that you want for this application cycle. So you will add that and it will auto-populate your total funds requested. The bottom half of the program expenditures page is going to be your total expenditures for the academic year 24-25. This is for all expenditures made by your program, not just what was used on using Song Brown grant funds. The total for the expenditures page should be equal to or greater than the total funds requested. The aggregate student data page, this is going to be just numbers. You're going to tell us the enrollment capacity for your cohorts, the number of students that applied, the total number of students enrolled, and the enrolled students for your first years or your second years. If you have 2 start dates per year, it is going to be your second years will be fall 23 to summer 24. And your first years will be fall 24 to summer 25. Those are how the breakdown is for your aggregates, to make sure that you're putting them in the right year. Then you will enter all of the race ethnicity data for your students, and that total should match the total enrolled in the above slide. If you have students who are identified with multiple races or ethnicities, you can list them as other, not listed. For graduate data, you will break this down also into 2 graduate years, academic year 22-23 and academic year 23-24. You will enter the number of graduates per academic year, and you will add a site or add a graduate and also review, edit, or delete using the same buttons as training site. This is the pop-up that you will see for your graduates. You will enter their graduating class, first and last name, gender, ethnicity, and race category. If you are an ELM application, your graduates should have NPI numbers, so you will enter their NPI as well. Or if you are a BSN or ADN, you will just do no on the do you have an NPI number. You will then enter their practice specialty, and if you know their graduate practice site. So for graduate practice sites, we want to collect any California graduate practice sites. If any of your graduates are practicing outside of the state of California, you will select no and select out of state or other if you don't know the graduate practice site. We will also need the graduate's NPI. So the NPI number for this particular form is for the graduate and not for their practice site. The required documents for RN, existing and expansion, are the approval letters. So the BRN approval letter for existing, and if you are applying for expansion, the BRN approval letter for additional slots. All documents for the approval for existing has to have the prefix APPR_, and for the expansion, it is EXP APPR underscore in order for it to be valid and uploaded to your application. You can also delete any documents that you need to if you put in the wrong one in the dropdown on the right. Once the document is successfully uploaded, it will turn green. If the button is still red, that means you have not uploaded the document and it is required. Once you completed your application, the program director will certify the completion and accuracy of the application, and they will be able to submit. Just a note, you cannot make further edits once you submit the application unless you utilize the early submission review, where Song Brown staff will review your application, give you feedback, and then you can go back in and make any edits necessary. But once you submit your application, the submission is final. All right, now we're going to walk into the RN new and LM new application. So a lot of RN new and LM new are pretty similar. There's just a few things that are different, and I'm going to highlight that when we're going through that page. So for RN new programs, it's going to have the same program information page as the RN existing and expansion. The only difference is you're going to be selecting no on are you a former Song Brown applicant, and you will directly be asked to enter your training program title and address. You will also then select the new program option, which is not visible if you are a returning Song Brown applicant, and then check those boxes to make sure you are eligible. For LM new, it's a little bit different. You're going to be asked if you have the Midwifery Education Accreditation Council accreditation already. If you are, you must be seeking Medical Board of California approval to be eligible. If you are not MEAC accredited, you will be asked if you are seeking MEAC accreditation to be eligible. You will then enter your training program and address as normal. For program description for the new programs, we want your executive summary to describe your new training program and how your program will meet Song Brown statutory priorities. Again, you will have 2,500 characters, not words, for the program description, and you will be notified once you reach that limit. If you copy and paste from another text, you make sure that everything is copied over. You don't want it to be missing. So both RN new and LM new will have the same set of strategy questions. This is your opportunity to tell us what strategies you plan to implement into your program that helps align with Song Brown statutory priorities. The only difference between the two is RN will say nursing students and LM will say licensed midwifery students. Otherwise, all of the strategy questions are the same. Multiple responses can be selected per strategy, and you will have the opportunity to provide a narrative about how you're planning to implement that strategy question. Just like the program description page, you have a 2,500 character limit for each strategy question that you select. There's also an option for other. If you have a strategy that you believe fits in with the Song Brown statute that we did not include here, you may list it there as well. Here are the other strategy questions 2 and 3. And 4 and 5. All of this slide deck will be in the website. So if you ever want to refer back to it before you apply, go ahead and click the link that we have pinned in the chat. You will be able to access the TA guides. I know that it might be quite small on your screen right now, but all of this is accessible through the Song Brown website, and you can read them there. They do have 2 separate ones. So LM has their own and RN has their own. So for RN new, this is what the anticipated training sites page will look like. It will ask you if you have any training sites to report. If you do not, you just select no. If you do, you will add those sites similar to the RN existing and expansion. For LM new, you'll be asked the anticipated percentage of total clinical hours that will be spent in areas of unmet need. That is just an anticipated percentage that you will enter there, and then you can say if you have any training sites to report, just like RN new. This is the form that will pop up once you add a site. It is similar. It is identical to the one that is in RN existing and expansion. We ask for the training site name, the address, and the NPI number for those sites. The program expenditures page will be where you ask us where you provide us how much you are requesting for your program. Maximum funding request for RNU is $1 million, and maximum funding request for LMNU is $500,000. From there, you'll press Save and Next and move forward into your required documents. So for the timeline, you need to upload it with the prefix LTR time _. And for the sustainability letter, you will be with the prefix of LTR SUS _. That is the only way that the documents will be acceptable in the profile or in the application. So make sure that your documents have that prefix before uploading. And just like RN existing expansion, it will turn green once the upload is successful, and it will remain red if you still have that document required to upload. Once all that information is captured, the program director once again can certify the application and submit. Please utilize the early submission review deadline where we will review the application and provide you feedback so that you can go back into your applications after submission and make any appropriate edits. I believe that is all for my presentation today. I'll pass it back to Chris to start our Q&A.
All right, thank you so much, Castany. As our team implements the latest cycle of this program, these webinars are an important way for us to keep you informed and respond to your questions. We're going to transition to the Q&A session. To ask a question, simply click the chat button in the menu bar and type your question. The chat should be enabled now. You can start doing that. We'll do our best to address as many questions as possible during our time together. If you do have a question about highly unique circumstances, we may ask you to email our team at songbrown@hci.ca.gov so we can provide the most accurate answer. And if we can get chat turned on, it looks like we're, give us 1 second while we get the chat turned on and we'll have that ready for you. Let's see here. One second as we get this sorted out. Okay, there we go. Now the chat is on. You can start asking your questions, and we will be happy to answer them. There we go. First question. On the slide aggregate student data, you stated the time frame for years. Can you please repeat those?
Yes, for the students, we're looking for 23-24 and 24-25. Did you want me to break down the breakdown if you have multiple start times as well? Okay, so for if you have multiple start dates for your program, the second years will be anybody who started fall of 23 to summer of 24. For anybody for the first years, you will be anybody who started in the fall of 24 to the summer of 25. Those are your first years.
All right, thank you, Castany. Let's see, what is the early submission deadline?
October 9th at 3 p.m.
Very good. And we do have that that information is pinned in the chat. If you look at the top of the chat window, you'll see that there's a resources post pinned at the top, and it has all of the links and dates in there as well. A couple questions. Oh, go ahead.
Oh, we do send out reminders for early submission. So if your application is in progress, we do send out a reminder of the week before and 3 days before and the date of that early submission deadline is approaching.
All right, yeah, thank you. A few questions here about getting copies of the slide presentation and the recording. Just a reminder, we will have that posted on our website. We ask, usually it takes, we ask for 7 to 10 business days to get that. Sometimes we get it earlier than that, but there are a couple steps that we have to do to make it accessible before we can put everything online. But those will be on our webpage within that 7 to 10 business day time frame. Let's see. Um, I submitted an email to change program directors. What is the turnaround time to assign someone as the program director?
Usually it takes us about 5 to 7 business days to do that. But sometimes it gets lost in the inbox because we do share an inbox with our PCR staff. So if you can, just send us an email again and I'll be on the lookout for that and I'll make sure to make those changes right away.
All right, thank you, Belinda, for that question. Rebecca asks, as a new applicant, how many slots are available? Also, if we applied several years ago but haven't since then, are we considered a new applicant?
Okay, so new applicant is a new program. So if you are a program that has not reached accreditation or approval yet, you are considered new. To be eligible as a new program, you have to have not enrolled your first student, and you cannot have been a former Song Brown applicant. So there are no new slots for new applicants or new programs. You would still apply as an existing and or expansion program, even if you haven't applied in a few years.
And this ties into the next question as well. If we're an existing ADN program but have never received Song Brown grants, are we a new or existing expansion applicant?
Great question. You are an existing and or expansion applicant still.
Right. Thank you. Next question. Hello. We are not required to add the NPI number for the graduate students for RN, correct?
That is correct. So you only select yes if you are an ELM and you know the graduate's NPI.
Jenny asks, for the graduate data, it is asking for AY 2022-2023 and 23-24. Can you confirm if this is correct? These were the same years asked in last year's grant.
Last year we asked for 21-22 and 22-23. So we are asking for 22-23 and 23-24 this year. The gap year would be the 24-25 graduates. So anybody that graduated June, April, like May to August this year.
All right, thank you. Rebecca asks, we have a director of nursing, dean program specialist, and financial specialist that will need access to the HCAI portal. What roles do we assign to each of these personnel?
So as the program director, I believe, Rebecca, you are the program director for your program. You can assign them as grant preparers and they will have access to any application that you initiate. So as soon as their profile is created, you can assign them to your profile directly.
All right, thank you. Next question. Brittany asks, is there a formal definition of areas of unmet need that HCAI uses, or is demonstrating disparate outcomes of target populations sufficient?
Yes. So included in the list of pinned resources in the chat, you will be able to link to the Song Brown glossary. There is an approved definition for areas of unmet need in the Song Brown glossary. It's alphabetical order, so you can just scroll through and click directly on areas of unmet need, and it will give you that definition.
Rebecca asks, as an expansion applicant, what is the max slots available to apply for?
Be 5. So regardless of how many slots you were approved to add to your program, the max expansion slots for our application is 5 slots.
Great, thank you. In the PDF version of the, is there a PDF version of the application?
There is a PDF version of the application. Once you initiate the application, you should be able to print the application through the grant applications tab. But the TA guide that we have posted to the website does have all of the pictures of the actual application in it. So if you can't print it for some reason, that is the best resource to use is the TA guide. The RN has their own TA guide, so it won't have LM mixed in, and LM has their own TA guide, so there won't have any RN mixed in there. So that is linked in the chat and pinned to the chat. So make sure to use that. But I do believe you can still print it via after initiating in the grant applications page.
All right, thank you. And again, check in the chat. You'll see all of the links and everything that we have resource-wise there. Why are the 2024-2025 graduates data not requested in this year's application? Sarah asks.
That's just the gap year that we have. We usually have a gap year every cycle for the graduates that we're asking for. And this year, that is the gap year of the graduates that we're requesting information for.
All right, thank you. Looks like so far we don't have any more questions. We've got plenty of time today, so if you do have any other questions, this is a great opportunity for you to ask them. Reminder, we will be posting all of these resources, the webinar recording and the slide deck on our website within 7 to 10 business days. And again, the early submission review is October 9th at 3 p.m. And we have the close date of October 23rd at 3 p.m. Next question. As the URM students and graduate data will no longer be scored, how does that affect the scoring rubric?
Yes. So in our grant guides, also posted in pinned in the chat and posted on our website, you will see the new scoring criteria for RN and LM. That will tell you the new scores for the applications. So as of now, for this application cycle, after we removed URM, the total points possible for RN existing and expansion is 50. So go ahead and review the grant guide that has more detailed breakdown of what is getting scored this year. And if you have any questions, email our Songbrown email for further explanation.
All right, thank you. How soon will we receive feedback if we submit by the October 9th early submission deadline?
Okay, so if you submit right on the 9th, usually takes us about 5 to 7 business days for you to get any feedback. You can also submit any time before October 9th if you want feedback quicker, and we can usually give you feedback in 5 days, usually probably sooner, but usually 5 days. I will say 5 days. I will keep myself accountable to that.
All right, thank you, Destiny. All right, again, we still got plenty of time in today's webinar. If you have more questions, this is your chance to do so. Of course, if you don't think of any questions now, but 10 minutes from now and we end the webinar and you say, oh, what about this? Please email us at songbrown@hci.ca.gov and we'll be able to help you out with that. So, all right, Shara asks, I'm creating a profile and I'm only seeing organization for healthcare workforce support. Your slide showed organization. Is there a difference?
There is not. As long as it's a organizational user type, that will work. And if it's not working, just shoot us an email at the Songbrown email, and I will look at your profile on the back end to make sure that you're in the right user type.
All right, thank you. Rebecca, thank you for the support. It's good to see you as well. We appreciate everybody joining us. All right, Belinda says that the email is provided for the program director access, so you should have that in your inbox. Beth says you don't see anything pinned in the chat. Thank you for flagging that for us, Beth. We will repost those things again right now in the chat so you can see them. Sometimes if you sometimes Teams does that where you can't see things in the chat, so Alma will get that posted again for you to be able to see. Let's see here. All right, it appears there's a big time difference where I am in California. The meeting had a 10:30, but it appears you have been on almost an hour. What time is this afternoon? It's a great question. We did start right at time at 10 o'clock today, but we do have a second session coming up today that starts at 3 p.m. And so that's a great time to mention that. If you have anybody who was unable to attend this morning's webinar and you want them to see it, have them join us at 3 p.m. and we will go through the same information and we'll have a Q&A session as well for that. All right, next question. Do you need the NPI for clinical facilities where our clinical sites or where the graduates are working as well?
So there's two NPI numbers that we're requesting. So for your training sites, we need the NPI number of the training site. For your graduate practice sites, we need the NPI for your graduates. So when you're entering training site information, it's the NPI of the site. When you're entering graduate data information, we're looking for the NPI for the graduate.
All right, thank you. Let's see. I may have missed this. Can you clarify that early feedback could be used to improve the application due by the 23rd?
So the purpose for early feedback or early submission is to make sure that you have all of the information required for the application. We do not score the apps until the final submission, so we cannot tell you if the information you provided gives you a better score. So it's mostly to make sure that you have all the required information that you need for your application. Because we have 50 points this year, we only have 3 scored criteria. I'm really focusing on making sure that you have all the relevant information for those particular scored criteria.
All right, there we go. Vaughn asked, is the same link for the 3 p.m. session? It's not the same link. It is a separate registration link. I posted that in the chat for you there, and you'll be able to use that for anybody who needs to register for the 3 p.m. webinar. All right, if we don't have graduates for the 23-24 year or earlier, since our BSN program is so new, does that negatively impact our score?
Hard to say with that in particular. When was your first set of graduates?
25. Thank you, Sarah.
Yes, it will, because that is one of our scored criteria. But you still have the training sites. So training site in areas of unmet need, or RNSAs for the RNs, and payer mix for those training sites are the other 2 scored criteria for this application.
All right, thank you. And we always encourage people to go ahead and apply, no matter where they think they might or might not score on it. It's always a competitive process. Let's see. Next question. What is the total amount for both grants, EXT and EXP, for this year?
If you are requesting the full or the maximum amount for each, it will be $600,000. So 300,000 max for existing and 300,000 for expansion.
Mario asks, is the MPI number needed for an ADN program? Specifically, do we need it for our clinical sites?
Yes. So any training sites, regardless of the RN pathway that you have, we do need the NPI number for your clinical training sites. It is only the ADN and BSN graduates that do not need them.
All right. Wonderful questions today. We really appreciate the engagement. We still have plenty of time left if we need it. So if there's any other questions, go ahead and get those in today. Does anyone know where to get MPI numbers for ELM graduates?
So we have linked the NPI registry. Typically, you could just put the graduate's first and last name in there, and the license that they should have in the NPI registry. So you could just use the link that's directly on the application, and you should be able to find them, hopefully.
That link is in the application?
Mm-hmm. Yes, it is right next to the NPI field. So you'll see it. It's going to be a blue link that says NPI registry.
Perfect. All right. Well, looks like questions are slowing down. I'll give another call out. There we go. Another question. Since the 24-25 graduate data is not being considered for this year's application, will it be considered for next year?
We will be adjusting all of the data we're collecting by 1 year. So everything that's this year will just be moved up 1.
All right. And Penny asks, do graduate BSN need an NPI number?
No, they do not. I don't believe BSNs have NPIs. If they do, you can enter them, but they are not required for BSNs. You can just select no on do you know your graduate's NPI.
All right. Belinda asks, last year there was a slide on what the funds can support or not. Will that be covered again?
Not this time around. We are hoping to have an allowable cost document available for anybody who is awarded the grant. So that is not something that we have at the moment in this particular slide because this is focusing on the application process. I will say that the general rule of thumb for Song Brown grants is that expenditures should be direct, anything for the direct education and training of students. It is for the program to enhance your education and training of your students. It is not a grant or scholarship for your students. So that's the general rule of thumb, is direct training and education of your students via enhancing the program.
All right, thank you. I'll give another minute or so for any more questions we have today. As always, we really do value this time with our applicants. It is helpful for us, and we know it's helpful for you as well. Appreciate all of the great questions we have today. And of course, Cassidy, we appreciate your expertise being here to help everybody out. All right. I'll drop that registration link in the chat one more time for you here for the afternoon session in case you're unable to go back and see it at the top. Let's see. This webinar was so informative, professional, efficient, and well run. Thank you. Thank you for that feedback. We appreciate that. And we're glad that you found this valuable.
During this lull in our questions, while we wait to see if anyone else asks any other questions, I do just want to set another reminder just to put it up that the early submission deadline is October 9th at 3 p.m. Not end of day, 3 p.m. I just really want to highlight that because sometimes people get confused. So October 9th, 3 p.m. early submission deadline. You can submit your submission early at any time between now and then, and we will review those accordingly. And then the final submission is October 23rd at 3 p.m. as well. October 23rd, 3 p.m. Okay.
All right, thank you for that reminder, Cassidy. And we really do encourage you to take advantage of that early submission deadline. It makes sure that you have the best chance and we get the best submissions. It helps everybody out with that. Jade asks, will funding be prioritized for new programs or will there be separate funding for new and existing programs?
So overall, this is a very competitive application cycle. With $2.725 million in our budget. We don't have a particular priority. That is something that we discuss as a team and with our directorship. So it is competitive all around as it is every year. So I would just get as much information as you can into your applications because it will be competitive no matter what. But to answer your question, we do not prioritize one over the other. It's all based on scoring and what we see during after final submission.
All right, thank you for that question, Jade. All right, I'm going to give about 30 more seconds. If you have your all your questions answered and you have no more, if you can give me a thumbs up in the React button, that'll help me know that we're ready to move on to the end. If there's still some questions coming in, we're happy to answer them because we do have time. Melinda asks, confirming the total amount to be awarded is $2.275 million.
Okay. 2.725. So the total available funding for RN, new, existing, and expansion is $2,725,000. So $2,725,000 or 200. $2,725,000. So 2.725.
725.
Mhm.
All right. Very good. Thank you. All right. Well, I'm seeing a lot of thumbs up here, and I think we'll go ahead and move on. Again, if you have more questions and we didn't get to it today, if something pops up later, please just email us at songbrown@hci.ca.gov, and we'll be happy to get your questions answered. Thank you again for your thoughtful questions, your participation. It really does mean a lot to us. We appreciate you joining us to learn more about the Song Brown Registered Nurse and Licensed Midwifery Program. This program is an important part of HCAI's health workforce development efforts, and we're grateful for your engagement today. A few reminders before we let you go today. The early submission review deadline, as we mentioned, is October 9th at 3 p.m. The application period closes on October 23rd at 3 p.m. Don't wait to submit. Get those in. And we would love for you to visit the rest of our resources. Please visit our website to explore the full range of HCAI resources. We'd also love for you to follow us on our social accounts. And one of the things that we love is when you tag us with the work that you're doing. In particular, if you do get awarded a Song Brown grant, which we hope you do, as you do that work, please document it, tag us on social media. We love to see the great work that you're doing. It really is encouraging for all of our staff here. And then lastly, we ask that if you want to stay up to date with what's happening in health workforce efforts here at HCAI, go ahead and subscribe to our monthly newsletter. Our monthly health workforce programs update goes out with all of those information that's happening now. Simply follow the link and select any topics of interest under the healthcare workforce heading, and you'll be added to the list. And you can contact us. There's our phone number on screen and our email. Again, songbrown@hci.ca.gov, and we will get back to you and get all your questions answered. We do appreciate you attending with us today, and we hope you have a wonderful day. With that, we conclude our webinar. Thank you, Castany, for all your help, and we hope that you have a great day.